How does a lipid panel test work? Have you ever wondered how a lipid panel test works and what it tells you about your health? This test is essential for understanding your cholesterol levels and overall heart health. Let's break it down step by step. A lipid panel test measures the levels of fats in your blood. This helps evaluate your risk for hyperlipidemia, which means having high levels of lipids and related cardiovascular diseases. To start, a healthcare professional will take a blood sample, usually from a vein in your arm. They will tie an elastic band around your upper arm to make the veins easier to access. After cleaning the area with an antiseptic, they will use a needle to draw the blood. This process typically takes less than a minute and may feel like a quick sting. In some cases, especially for quick tests, a small drop of blood may be taken from your fingertip instead. For the most accurate results, especially when measuring triglycerides, you will need to fast for 9 to 12 hours before the test. This means no food or drinks except for water. However, some tests may allow you to eat, so always follow your doctor's instructions. The lipid panel measures several important components. First, there is total cholesterol, which is the overall amount of cholesterol in your blood. Then, there is low-density lipoprotein cholesterol, often called bad cholesterol. High levels of this type can lead to plaque buildup in your arteries. On the other hand, high-density lipoprotein cholesterol is known as good cholesterol because it helps remove the bad cholesterol from your bloodstream. Next, we have triglycerides, which are a type of fat. Elevated triglyceride levels can increase your risk of heart disease. The test also provides calculated values like the cholesterol to high-density lipoprotein ratio and non-high-density lipoprotein cholesterol, which give additional information about your cardiovascular risk. Once your blood sample is taken, it is sent to a laboratory for analysis. The lab uses methods like spectrophotometry, which measures how much light the blood sample absorbs to determine the concentrations of lipids. After the blood draw, a cotton swab or bandage is applied to the puncture site to stop any bleeding. You can usually return to your normal activities right away. If you fasted, it is a good idea to eat soon after the test to replenish your energy. From the perspective of managing hyperlipidemia and cholesterol, the lipid panel is vital for diagnosing elevated cholesterol levels. It helps monitor how effective your treatment is and guides any necessary lifestyle or medication changes to lower your cardiovascular risk. Regular testing can help catch unhealthy lipid patterns early, allowing for timely action to prevent heart disease and its complications.